So today, myself and the speakers will be discussing building positive relationships. We do actually have Robin here from Rumballara as well, who will be just having a little chat about, Andrea, about the poster. First of all, I'd like to acknowledge the traditional owners, the Wurundjeri people of the Kulin Nations, and pay my respects to the elders past and present, and also pay my respects to other Aboriginal people that are here today. Okay, so we've just had an introduction of the presenters. We've got about 45 minutes, and if we can just wait till the end for any questions, that would be fantastic. Partnerships. So partnerships, the meaning of partnerships goes way beyond your Oxford, your dictionary meanings, especially in the Aboriginal community controlled organisations. It's about working together. It's about the collaboration between each organisation with that trust, respect and honesty. These underpin quite a bit of the partnerships. There, of course, are a lot more than that, and it's about Aboriginal people working together with non-Aboriginal people. And our speakers today, who embody all of these qualities and more. So first of all, I'd actually like to invite Carlene Miller, our Aboriginal Liaison Officer at the Royal Dental Hospital of Melbourne. She's been here at DHSV for 3 years. Tanarong woman, very proud Aboriginal woman from Victoria. She'll discuss our partnerships. They're not just about organisations, they're partnerships with the community as well. So she's got a bit of a story to tell you about one of our patients. Carleen?
I would like to share a patient story with you, which illustrates the need to address Aboriginal health from a holistic perspective. It also highlights how mainstream health services can work in close partnership with Aboriginal community-controlled health organisations to provide coordinated services to meet the needs of community members with complex care needs. Before I begin, I would like it noted that I have sought my client's consent to share her story, and to protect her confidentiality, I will use an alias. Anne is a 45-year-old Aboriginal woman. She's a single mother of 4. I first met Anne in 2011 when she was referred from our general surgery department for extraction of several teeth. She has a phobia of needles and had refused to have extractions in the chair. We had a yarn over a cup of coffee and she shared her life story with me. At that time, Anne was living with her teenage son, who was in trouble with the law and causing her much distress. As a mother, she felt it her moral duty to support him, despite at times feeling unsafe due to his verbally abusive outbursts. Excuse me if I get a bit emotional. Anne found this particularly difficult as she had experienced early childhood abuse from her stepfather and felt unsupported by her own mother. She had spent many years in foster care. She was disconnected from her family of 3 siblings and her culture. It was evident that Anne needed support with her physical health and her emotional and spiritual well-being. I invited her to attend a community event for women's well-being. It was here that I was able to introduce her to health workers from the Victorian Aboriginal Health Service. With the support of the health service, Anne was referred to counselling and was linked into a women's wellbeing support group. She was also seen by one of the doctors who diagnosed diabetes, and she commenced insulin treatment. In the interim, she had several appointments at the Royal Dental Hospital. Anne was seen in oral surgery and declined treatment under general anaesthetic as she was medically compromised. She was then seen in special needs dentistry department in August 2011 to have extractions in the chair with the aid of nitrate gas, which she refused. Subsequently, Anne was referred to the Royal Melbourne Hospital. I made contact with their Aboriginal liaison officer to refer Anne for ongoing support. I maintained contact with her after discharge to see how she was progressing. At Anne's request, I assisted her with a support letter to aid her application for a disability pension through Centrelink. Unfortunately, Anne did not have her oral surgery at the Royal Melbourne Hospital. Aboriginal patients are not given priority access there. So after a long wait and several outpatient appointments, she again declined treatment. According to Anne, she was admitted for surgery and only then became aware that the plan was for a full clearance. She was not emotionally prepared for this. I saw Anne again early this year when she was at the health service seeking dental advice as her oral health had deteriorated further. She was in pain with abscesses and her self-esteem was very low. She was still scared. However, with support and encouragement, was able to accept that a full clearance was necessary. The dentist at the Victorian Aboriginal Health Service made up pre-dentures to encourage her to follow through with treatment. In April this year, Anne was back here for an exam appointment with her pre-dentures in her handbag to show me. She was both excited and anxious. We scheduled a surgery appointment within 2 weeks. As promised, I was there on the day to support her through the process. She felt safe and we were finally able to complete her treatment. As she was a little groggy from the nitrate gas and emotionally overwhelmed, I decided to drive her home. She has since been back to the Aboriginal Health Service for a checkup and attended a post-operative exam appointment with us. In a further 1 to 2 months, she will return to VARS for a denture readjustment. This has been a long journey for Anne. The successful outcome only made possible by well-coordinated partnership between the Royal Dental Hospital Melbourne and the Victorian Aboriginal Health Service. And most importantly, by Anne's tenacity and strength of character. Presently, Anne continues to attend counselling and weekly support group meetings and is looking forward to August when an elder son and his partner will make her a proud grandmother. Thank you.
My name's Andrea and I'm from Rumballara Dental in Mooroopna. Up there you're seeing a beautiful new building that we've just took possession of last August. I'm a non-Indigenous person who's worked in Aboriginal health for the past 13 years with these two lovely people over here from VARS. And then the last 10 years I've spent in Mooroopna at Rumballara. My husband's a Yorta Yorta man and we've got 3 lovely children. And we decided after being in the city for a while to go back to the country, so it's like going home. I didn't actually know a lot of people in the community when I returned there. But over the last 10 years, I would call them my family now, and I'd like to think that they accept me as part of their community as well. The clinic was established in 2003, and we just operated a single chair out of a rented premises in Shepparton. The initial funding for this chair came from ACCHOS, and Rumballara sort of took it on and took quite some time to find a dentist to operate this chair for them. When they finally did get a dentist, to operate after several years, they sort of did it, taking a risk because they weren't sure if they were going to get additional funding. Obviously, they did get additional funding and we've, grown from that one little chair over the last 10 years. So we moved again back out to the actual Rumballara site in Mooroopna in 2005. This was partially funded through DHSV, 2 chairs in a portable building, plus our own chair that we already owned. That was the beginning of our partnership with the Melbourne University and the rotation of students coming through for their rural placement. That has been an enormous, lovely partnership for us at Rumballara. We've got to meet so many lovely kids, and we do call them the kids because I'm old enough to be their mother, most of them anyway. With this move into the portable building, we changed the name of our centre to the One Year Oral Health Centre. One year in Yorta Yorta language means boomerang, and of course our aim is to have people coming back, not just because they've got a toothache, but because, you know, we really want to see their oral health improve. Then in September of 2011, we got our new building. So this was a federally funded building that Rumballara and the board decided to build. We've got our medical clinic and our dental clinic all in one area. That has so many pros for us because, you know, I can wander out to the waiting room and have a chat to people and say, by the way, I haven't seen you in the chair for a little while. You must be due for a checkup. So, you know, and you've got that lovely, you get to mix with the whole community, whereas before when we were in the portable or we were in Shepparton, you're a bit disjointed from the rest of the community. So it's really important that, you know, we all feel together, they get to know my face, you know, and the other staff's face so that they feel quite comfortable with us. So our new clinic has 4 chairs, 2 are funded by DHSV and the other 2 are federally funded. Our new clinic has couple of larger rooms, so we can have family groupings in there, and we encourage the parents to come in for their checkups with their kids and, you know, getting them used to being in that environment so it's not such a foreign environment, because you've got to remember that a lot of the adults that are actually coming through have only ever used dentist as a toothache service in the past. So we're trying to change the way that they think and getting them to come in all the time. Bring the children, encourage them. So it just becomes a way of life. It just becomes part of what you do to look after yourself. We operate 5 days a week, 9 to 5. We've got 4 part-time dentists. We've got an oral health therapist. We've got a part-time demonstrator for the students. We've got 5 qualified DAs, 2 of which are Indigenous girls. And we have a visiting prosthesist half a day a week. We're really fortunate to have all of our staff. There's 2 of us that have been there for 10 years, another one for 6 years. Then the rest are like 4 and 3, and the 2 younger Aboriginal girls have just completed their training. But unfortunately, they both sat on the same chair and they're now both pregnant. So we need to start again. Our scope of practice is expanding all the time. Some of the dentists that are coming and do a couple of days a week, one is an overseas trained dentist, and she's just, you know, in the last 18 months, she's worked at GV Health and with us, her first job here in Australia. And that's just worked out to be, you know, a really good thing that's been happening. And I've lost my train of thought. Yeah, our staff, the scope of practice. So she's doing lots of general dentistry, getting her skills up to speed. We've got another private practice dentist who comes in 2 days a week. He's been awesome to have around. He's got orthodontic skills, which he's sharing with us, so we can offer a limited orthodontic service, but it is a fee-paying service. So it's not as expensive as going to private practice, but it is still quite an expense. So that is there for our community if they've got the wherewithal to do that. We do a fair bit of endodontic treatment, which is really nice. When I first started there, we hardly did any endo work at all. It was just all extractions, and people couldn't be bothered saving their teeth. So you feel this real sense of pride that people are now saying, well, actually, I need that tooth to chew on, and it's because they've been educated. And so over that 10 years, you know, we've made great steps with that. So we do a bit of endodontic treatment, and we do have a couple of dentists who will do crowns, but once again, that is a fee-paying service as well. The Greater Shepparton area has the largest Indigenous population outside of Melbourne. The last estimates of the figures were 6,000 to 7,000, and since the establishment of the dental service at Rumballara, we've treated over 4,500 clients. So I think that's fairly significant that most of the population are using our service at one stage or another. And our figures also show that about 250 of these people have travelled from the lower New South Wales area, Dinalequin, Moama, Albury. I've got myself a little note on the side. Doesn't matter. Some of the initiatives that we've started since beginning, we have an outreach service. So basically, we'll take some of our Bachelor of Oral Health students and we'll go to visit kindergartens, creches, those sorts of places just play games, have some fun. We've got some little portable mirrors with lights on. The kids can have their teeth looked at, and if we can see anything, we'll write a little letter to the parent and say, we can see some stuff in the mouth. We'd really like you to come in for an exam. Sometimes it works, sometimes it doesn't, but we will catch up with them one way or another. Hopefully, we have visited some rehab. There's a rehab clinic in Mooroopna near us. We have done some work out there. They're really onto it now though, so we sort of don't really need to be going out there all the time, because just the couple of times that we've been out there, they're like, oh, this is fantastic. So basically when they get a new client in, they encourage them to come in and have their checkups and things like that. We do information centres at other co-ops as well. And hopefully in the future we'll have a bus or a van, like an operational clinic to take with us. We've got a schools program too. So most of the schools in our area have Aboriginal liaison officers that work in the schools. So one of our Indigenous girls, she liaises with those guys, and we decided to start at those teenage years, when they start getting their own pocket money, having jobs, and can buy their own fizzy drinks and all those sorts of things. And so if we start at the top end too, we're catching that group of kids before they leave school. So what we do is we send all the paperwork home, it all comes back signed, we get the kids in and we do like a teen dental checkup. And then we send a letter home explaining what else needs to be done. If we need to get further consent, we do that. And then our staff members will go into the schools, pick them up, bring them back on a Thursday, and we complete the treatment. We've had pretty good results with some of the younger age groups. Some of the older age groups, they're not so great. They've, perhaps they're doing VCE or something, and they, make every excuse under the sun not to come back to the dentist. But we will get them too. We also, we use titanium in our clinic, so we use the recall system on that. That works to a certain extent, but a lot of it, sometimes does, sometimes not. And that could be for a variety of reasons. Our community can be quite transient at times. So, when we have students come through and people haven't turned up, perhaps it's because they didn't get their recall letter. Maybe. And talking of the students, one of the most exciting partnerships that we've got is with Melbourne University, with the dental students and the oral health students. Some of the feedback I've had from the students is that, especially overseas students, they don't know anything about Indigenous Australians. So, we're sharing the culture with them. They're learning the whole time that they're there, different things about the Aboriginal community. Some of the metro students that visit us, they really don't go to the country very often, because that the world ends, at Broadmeadows or, the outer regions of Melbourne. So they're actually seeing country areas that have got a lot to offer. They're seeing lovely clinics in the country that they didn't know existed, and there's all this scope for private practice and public practice in our area. We like to, if possible, we try to book the same people back to the students, getting a bit of continuity of care happening. The students have said to me that they like the more personalised approach that they get to spend with the patients. They seem to have more time. They don't have to hang around too long waiting for a demonstrator and all of that sort of stuff. So, they find it quite relaxed and, not easy going, but they do enjoy it. So we have a ratio of 2 students with one demonstrator, and Dr. Paylin Chong is one of our dentists, and she demonstrates some days. And Peter Garrett, who is a local dentist, he's been working in Shepparton for 38 years. He's now retired but comes to Rumballara 2 days a week. And Pete's a great advocate for Rumballara in the wider community and the dental circles in the area too. And also by having the students, we can see up to an extra 8 clients a day. That extra 8 clients a day makes a big difference when they turn up. We do have a problem with FTAs, and we're all the time working on those issues on how do we improve this so that we don't have so many FTAs. And of course you double book them and then everyone turns up and all hell breaks loose. But that's okay, we all manage. The rural rotation has seen a number of students come back to the Golden Valley area to practice dentistry. As I said, Carleen, she came through Rumballara as a student. She then did a grad year at Golden Valley Health Dental Clinic, and then she came to Rumballara, and she's still there. She's been there for 4 years. We love Pay, and she's been really, really great. She's got lovely skills and a lovely way about her, and she's fitted into our community really, really well. She also does some private practice work in Mooroopna as well. And then over the last 2 years, we've had Bachelor of Oral Health students from La Trobe University rotating through over their summer break. They don't really have a break. I shouldn't call it a summer break. They don't have a summer break. They do a placement, so their course sort of finishes 6 months earlier than everyone else. And we've extended that this year. They've actually been coming sort of on and off since January. So it's really interesting for us to have all these oral health kids coming in, and they are only babies. And, you know, sometimes they're treating people who are older than them, which is giving them the world's best advice and all of that sort of stuff. It's lovely to see. And they enable us to do more outreach with kids, and we can take these guys with them. They're there with us more often, and we can take them with us. Am I getting a wind up? Yeah. All right, so basically Rumballara is a really awesome place, and whilst we don't have an official partnership with Golden Valley Health, the dental unit there, we have a really positive working relationship with them. Things for the future for Rumballara, the dental van, we hope. Visiting specialists, we hope, and maybe extended hours of service, I hope not, but, but that's, thank you very much.
So, the Victorian Aboriginal Health Service is a registered cooperative, and our organisation is controlled by 7 Aboriginal directors who are elected by the community at an AGM. So, and our organisation is situated in Nicholson Street, Fitzroy. First started back in 1973, and it actually started because local elders within our community were concerned about inequalities in Aboriginal health for community members in terms of accessing medical, sorry, I've actually gone too far. Basically, VARS is an affiliate of VACCHO, which is the peak Aboriginal state body of Victoria, and which is an affiliate of the national body, NACCHO. VARS is the part of our core business in terms of VARS actually getting Aboriginal health, both on the state and federal level. We have what's called VACCH, which is the Victorian Advisory Council on Koori Health. And sorry, I'm all over the shop at the moment, but VACCH core members consist of a tripartite agreement between both the Department of Health and Ageing and OATSI and the Department of Health in Victoria and VACCHO. And Dental Health Services Victoria also sit on there as a leading oral health body. So VACCH provides a forum for the state and the Commonwealth governments and the community controlled sector to work collaborative and improve health processes and outcomes for Aboriginal people. Okay. So, as I was saying before, local Aboriginal members within the Aboriginal community were concerned about our community and basically access to medical services. So at that time, there were a lot of our community members were dying far too early from preventable conditions, and at that time, the only medical assistance that our community were actually receiving was from the local pharmacist. So in terms of medical treatment, our community weren't actually accessing. And that was due to whether it was a racial thing, socio-economic issue, but all those conditions that our community were actually dying from were actually preventable. So that's what I wanted to highlight. VAS was actually formed in 1973, and this year we're actually celebrating our 40th year of service in August. Our health profile, we have over 65,000 client contacts per year, more than 10,000 active clinical files, 30,000 dental files, representing 75% of the Victorian community. VAS delivers a holistic primary health care, which with extended specialist care and expertise in managing chronic disease. And where would we be without it? So basically, within our service, we have over 168 staff members, some full-time, part-time staff. We provide a range of clinical services, so which is our medical, dental. We have a community programs service which caters for our elders and our disability. We have a women's and children's area. So we have paediatricians, we have a maternal child health nurse, we have Aboriginal health workers, audiologists. Within our allied health, we have allied health services. We have a podiatrist, optometrist, OT. We also have a social emotional wellbeing unit, which is actually situated at Preston, because we've got 2 sites now because we've grown that much that we've had to expand. So at our Preston site, we also have a men's health unit. We have a healthy lifestyles unit, which looks, which does a lot of health promotion stuff, goes into the community, and talks about tackling the smoking cessation, nutrition. So that's also provided. Okay, now our dental service started back in 1974, and I'd just like to acknowledge the late Dr. Bill Roberts, our first dentist, who actually came to our service as a volunteer and was there for many, many years, and he was very instrumental in actually getting a lot of the health services and access, and also talking about the Aboriginal health service at that time. And I do apologise because there is a typo, so if there's any family or friends of Dr. Bill in the room, I do apologise for that, because it's got Bob. So, but I think he was playing with me, so, because I did change it. Our current staffing levels at VAS, we, well, there's myself as the oral health manager, but we have an acting oral health manager now. 3.5 full-time dentists. We have Aboriginal health workers / sterilisation people, 6 dental nurses. Some are actually trainees and are currently undertaking their Cert 3 here at RMIT. So that's our team. And just wanted to show VAS, when it first started back in 1974, the dental side of it was how VARS could actually support the rural areas. So we, at that time, we had 2 dental vans going out. This van in particular, and it's named after our late driver, who was with VARS for over 35 years. So in his memory, that van, we still own that van, but it's now been turned into a medical screening van, which goes out to the community and does a lot of health promotions, health assessments to the community. And we also had a Mazda bus as well, so which would travel around to all the country areas, regional areas, and provide dental services to the Aboriginal people. So that's our bus, which was converted into a dental van. Okay, I'm going to actually pass you over to Dr. Thomas, but I just wanted, before I do, the rural van, so we service the whole state of Victoria, and each rural area would stay in that community for 2 weeks at a time. So clients would come and see us. We'd be there from Monday to Friday, but depending on the location, we'd have to stay in some of those areas over the weekend. So, and so we tried to do as much as we could for the time that we were there, and any patients that needed to be referred for follow-up treatment, we'd refer them to the hospitals at that time. But given the amount of times that we actually returned to a certain or a particular area, clients were still representing with the same issues after 6 to 12 months. So, and we do as much as we could to actually treat that patient's issue at that time. But in terms of regional areas, patients could not follow up with their treatments due to long waiting lists, and also because of racial and social economic reasons. But I can tell you now that currently, VARS being the largest dental service, there are 7 other Aboriginal dental services that are being delivered across the regions. So that's Robinvale, there's one in Warrnambool, Watherong, Rumballara, Jacqui, which is in Vansdale, Sale, and there's one in Wollongong. So thank you, Alex.
I'll just have to quickly go back 1 slide, 2 slides. This is my mobile. I used to work in there. I used to travel from Melbourne all the way up to Mildura, staying in every town for 2 weeks and treating people. You got to understand, when I go there, you see patients with severe dental problems. They would not have gone to the dentist or the doctors because of many, as we always say, social, racial, and economic reasons. And when you go and see all these things, you know, they don't want to come and see the dentist. They want to come, put the head into the van and say, "Hey, mate," and they just disappear. Christine and I used to go to their houses, talk to them, go to their houses, cook food for them, rice and curry, and they come back and get the treatment. And when I started, it was only 2 or 3 patients a day, sometimes, to when I finished, it was about 30, 35 patients a day. And some places I start at 8:30 in the morning. My time's only 9 to 5. I start at 8:30 in the morning and finish at 8:30 at night. I don't get paid for it. We had to do it. That's how we changed the fear of the Aboriginal people and letting them come back and get the treatment. I haven't worked in this, I only worked in once or twice in this bus because every time I get up, I hit my head and my tires get caught on the side. Second, Aboriginal oral health is a disgrace. Okay, this guy, he was not homeless. He used marijuana. He had permanent partner. He had excessive fear of dentist. Poor upbringing. Parents never had any oral health education. Never had any oral health education, or no was interested in his children's oral health. He brought his child to me and said, "Bruce, have a look in his kid's mouth. He's got too many decayed teeth." And he was smiling at me, and I could see his mouth was like that. So I referred the kid to Jacqui, what I do is that those days there was no, when Jacqui started, there was no liaison officer. So lunchtime, I get the referral, drive all the way from Aboriginal Health Service here, give all the referrals to Jacqui and say, come on, we have to ring all these people. And that's how we started. And then I asked him, would you like to come and have a dental checkup? He said he's 25 years old, he lives in the suburb, never been to the dentist because of the fear, heard about the vast dentist recently from someone who has been on the mobile. Okay, so because he heard about the mobile dentist, and then that's why he brought his child to us. He had a consultation and didn't turn up for a couple of years. He came back, got the initial treatment from me. Did he ever come back? Nah, I don't know what happened to him. So excessive marijuana use leads to dry mouth, lack of personal hygiene and oral hygiene in particular, food retention, they get the munchies, so keep on eating lollies, chocolates, whatever their hands can get on, and the food retention, dental decay, the resultant picture. The oral health education regarding drug use, dry mouth, and oral hygiene procedures and products was never given to him, nor his parents, and nor his kids are going to get it. Okay? So the lack of health education in parents is transferred to the children and to their children and the grandchildren. Now, this is how the system failed in molding the healthy citizen by the lack of health promotion. Okay? This is the other person. He came to me. He's a young person. He's a football player. He never wore a mouth guard, and he never brushed his teeth. Okay? The oral hygiene was so bad. He had about all the stumps at the top, slides being removed. So what I do is that I sit down with them, I explain the oral hygiene, and I take a lot of time. This is why when patients come to see me, and the appointment time's more, whether it's in VAS or in Plenty Valley, I've got the privilege of making my own appointment time. I don't work half an hour appointment slots. Okay, so in Fitzroy, we see 25 to 35 patients per day. Longer appointment times provide culturally appropriate treatment. That's very important. We refer to RDHM and community agencies. In the beginning, it was so hard to get any of my patients into any community health center while I was in the mobile, or to get into RDHM because of the long waiting list and because of the racial and socio-economic reasons. Patient did not keep any appointments. So what actually happened was that the specialty works were unmet. What I used to see every day was impacted teeth, pericoronitis, and so on and so forth. So I refer them to, as Christine said, I refer them to the community health center or to the dental hospital. Because of the long waiting list, they won't go. They may go there, but for the racial reasons or socioeconomic reasons, they won't get the treatment. And the other thing was a lot of kids who had multiple caries teeth. And we went to Swan Hill, Robinvale area, and you could see every child who walked into the clinic had at least 6 or 7 teeth decayed. You know, there's severe baby bottle decay there. So, and the poor periodontal disease due to high incidence of diabetes and orthodontic problems. So this is why we had to have a partnership with the Dental Health Service of Victoria. In 2006, the roundtable discussions recognized that lack of Aboriginal Australians attending the Dental Health Service of Victoria. Subsequent meetings with then CEO Robin Batten opened a new era. An Aboriginal Community Development Officer was appointed, that is Jacqui, and then we had a visiting oral surgeon come to Aboriginal Health Service so that any impacted wisdom teeth that could be done on the chair was getting done there. And from start, we had 4 patients a day. Now he comes and sees about 6 to 7 patients every day. Okay, now, Australian health ministers in whatever that is in South Australia endorsed a healthy mouth, healthy life in 2004. The advisory committee to Australian health ministers acknowledges the appalling oral health of Indigenous Australians. I would like to say a couple of things about the partnership. The plan of partnership should aim to build on, to improve and expand the capacity for the provision of oral health and the healthcare education system, to ensure that mainstream providers of Aboriginal oral health, Aboriginal and Torres Strait Islander healthcare workers work collaboratively with the Dental Health Service of Victoria. And that's how we can improve the access of the Aboriginal people into the community health centers as well as to the Dental Health Service of Victoria. Now, we watched all these slides, we saw all these things, how poor the oral hygiene and how bad the teeth look. And Christine also mentioned about social and cultural determinants of the oral health. When an Aboriginal person, what it means is that social and cultural determinants of health encompasses the conditions and circumstances into which people are born, grow through the childhood, live, work through their age, and the systems which is put in place to deal with their illness. And these systems are shaped by the forces of economics, social, and policies. What actually happens is that just because the Aboriginal people are born into that sort of situation, systems, and the systems put in place to deal with their illness does not work the way the government wants, because they don't understand the basic cultural aspect of the Aboriginal person. And what is social determinants means. Our people are affected by a range of social factors: poverty, economic inequality, racism, education and care in childhood, availability of quality food, addiction, discrimination, incarceration, and associated stress, anxiety, and insecurity, and the low self-esteem. This has demonstrated that this is going to end up in chronic illness. This is a proven fact that the associated anxiety with all these problems will lead to chronic illness. And moreover, we find that underlying cause of the health inequity faced by the Aboriginal people is produced as a result of intractable institutional constraints placed on human capabilities of an Aboriginal person in the areas of intellectual pursuit, social resilience, moral leadership, and dynamic cultural ability. What it means is that, you see an Aboriginal person, you brand them, druggy. You never get them to understand why they are like that and what can you do to help them. Please, this is what we could understand. An Indigenous person, an Aboriginal person is same as every one of us. Thank you very much for listening.